In 1994, German police went on a raid. They were looking for fake banknotes, but they found something far more sinister. Sealed in a canister were several grams of radioactive plutonium, the material needed to build a nuclear bomb. The discovery set off a scientific detective story which was to stretch halfway round the world. These canisters hold plutonium. If the energy locked in them were released all at once, the result would be an explosion. So every canister is individually marked and accounted for. Under highly controlled conditions, nuclear power stations release the energy slowly to make electricity. The energy and radioactivity come from the plutonium nucleus. The nucleus of every atom is made up from protons and neutrons, about the same number of each. The nuclei of most atoms stay like this forever, but radioactive nuclei are unstable. They're like pieces of popcorn waiting to pop. Once in its life, a radioactive nucleus decays and throws out part of itself as radiation. Some atoms throw out a pair of protons and a pair of neutrons together as a particle. This is alpha radiation. In another nucleus, a neutron might suddenly change into a proton, throwing out an electron at the same time. This is beta radiation. Gamma radiation is an electromagnetic wave with very high energy. It's sometimes given off by a nucleus which has just decayed in another way, as the nucleus struggles to make itself stable. Atoms of the same type always weigh, so it's often possible to work out what type of atom is involved by detecting and measuring radiation. The radiation is a telltale clue to the atom which created it. Alpha, beta and gamma radiation have different properties. Alpha radiation doesn't travel far in air. A sheet of paper will usually stop the alpha particles completely. Beta radiation is more penetrating. Paper has little effect. But beta particles find it difficult to pass through denser materials like perspex. Gamma radiation is the most penetrating of all. Only very dense materials, like lead, produce gamma rays.
Here's a diagram for you to fill out. Rewind the tape to the beginning of this section and make a table of properties of alpha, beta and gamma radiations. You should know what each particle is and what materials will stop it. OK, here are the answers. Alpha particles are helium nuclei and are stopped by paper. Beta particles are electrons and are stopped by perspex or thin aluminium. Gamma rays are electromagnetic waves with very high energy and are only stopped by lead.
Two years ago, a sports injury threatened to stop Gavin rowing. His doctor sent him for treatment that included a radioactive injection.
I originally hurt my back playing rugby. I've been having a bit of discomfort in my lower back and I've been to see my doctor, my GP. And she sent me to see Professor Hughes at Hammersmith Hospital.
And Gavin, this is an X-ray of your back and this is the front view of your spine. Normally the spine is straight in this view, but this picture shows a curve on the front of the spine with an abnormality in this bone here. And I think this is the cause of your pain, an acute fracture in your spine.
It was very concerning. It came as quite a shock. Nobody wants a bad back when they're 17 years old.
So what we'd like to do is to see whether this stress fracture is active, in other words, that it's trying to heal, or whether it's not doing anything. So we'll arrange what's called a bone scan.
Because radioactive material is injected directly into a patient, a bone scan can reveal details which would never show up on an ordinary X-ray. Seema Mohammed Targi will make up Gavin's injection. Large doses of radiation can damage body cells, so Seema has to protect herself and make sure the radioactive material stays inside her special laboratory.
Because it has to be injected into a patient, of course, it has to be sterile. And Seema's working within a sterile cell, within a clean room. You can see the rubber gloves, and they're held in position by the pressure of the air, which forces all of the dirt out of the clean environment.
The injection is made from a radioactive chemical element called technetium. It will travel through Gavin's blood to his bones. The technetium comes from a generator stored safely in the clean room.
This is the technetium generator that Seema's working with. I'll just take away the top. That's covered with lead shielding to keep the radiation away from the person operating the generator. What we've got inside is a column of molybdenum. This is continuously decaying into technetium. To wash the technetium through the column, we use some sterile sodium chloride, and the sodium chloride is sucked through the column to this sterile vial.
The hospital can use these radioactive materials safely because they don't stay strongly radioactive for long. The technetium injection will only produce strong radiation for a few hours, just long enough to do the bone scan. But the molybdenum generator which made it will last for about a week, long enough to make lots of injections.
If I'd been holding this amount of molybdenum perhaps 6 months ago, it would have been extremely dangerous for me. However, in that 6 months, it's decayed away and I can safely hold it.
On average, different radioactive elements take different times to decay. Looking at an individual atom, it's completely impossible to tell when it's going to pop. It could happen in the next few seconds. It might take 1,000,000 years. There's absolutely no way of knowing. But when you look at a large number of atoms altogether, it's clear that on average, some radioactive materials decay much faster than others. The average time it takes half the atoms in a large sample to decay is called the half-life. It takes more than 24,000 years for half a sample of plutonium to decay, but the half-life of other elements is measured in minutes or seconds, so their radioactivity disappears much more quickly. For this reason, radioactive elements with long half-lives tend to be more dangerous than those with short half-lives.
Here's a summary of the key points about half-life. You'll need to make sure you know them all for your exam. The half-life of a radioactive material is the time it takes for half the nuclei present to decay. The half-life of technetium is 6 hours. How much radioactive material would be left after 6 hours? How much after 1 day? Technetium is a good radioactive source for it doesn't stay radioactive in the body too long. Technetium emits gamma rays, so the radiation escapes from the body without causing too much damage. Alpha and beta radiation would be absorbed by the body, damaging the cells.